I wanted to talk a little bit about the culture wars and a lot of the stuff that you've been writing about for a long time in your book, The Diversity Delusion, and in lots of the stuff that you've written about campus stuff and the campus culture wars and the campus controversies. Because one of the questions that has come up fairly publicly in relation to COVID-19 is the question of whether a crisis as serious as this, in which we are being told that we must pull together as a society or else we will be screwed, whether it will weaken the culture wars and open people's eyes to the ridiculous nature of that kind of narcissistic, navel-gazing culture that has existed for a few decades now, or whether it will in some way energize it and draw some of those bad trends even further to the surface. What's your view, generally speaking, what's your view on what the impact of this will be on identity politics and all those problematic cultures?
The signs are not good. Right now, you still have the dance of the diversity deans in American colleges proceeding apace. Even as millions are losing their jobs, Harvard is just bringing in a new dean of belonging and inclusion that has come in from NYU, somebody that was working on multicultural understanding for NYU in Dubai. MIT just brought somebody in from a Southern university to be the equity and inclusion manager there. So nothing is changing in this grotesquely overpriced, parasitic edifice of diversity sinecures that are driving tuitions in the United States at private universities and public to just obscene levels like $75,000 a year. And I also recently, this last week, we saw the virus being racialized with the charge that Blacks and Hispanics had a higher death rate than whites in their respective cities or states. This was a charge that now has turned, for the people that are prosecuting it, the medical personnel have gone overnight from heroes to being bigots, because the claim is that doctors and nurses are denying care out of implicit bias to minority sufferers. The statistics on which these claims are based are completely bogus. The death rate for inner city residents is compared to the death rate for an entire state population that is completely different demographically. The higher rate in some places, and in some places it's minuscule, higher rate for Blacks than for whites, is completely predicted by what we already know regarding the comorbidities that are the most certain accompaniments of coronavirus deaths: the heart disease, the diabetes, the obesity, the AIDS, drug addictions, hypertension. Blacks have higher rates of those. Now, the left will say structural inequality. Another explanation is behavioral choices. In any case, this is not a race issue. And to make it one is to inject poison into a political debate that is fraught enough and helps nothing. I can guarantee you that the doctors and nurses who are working on the front lines are completely indifferent to somebody's color. What I've also noticed is that the alleged disparities in death rates for coronavirus are minute compared to the death rate disparities that are caused by urban violence. You know, in New York City, Blacks are about 22% of the population. They make up about 28% of coronavirus deaths. Well, in New York City, Blacks make up about 65% of homicide deaths. In Chicago, Blacks are 83% of homicide deaths, even though they're a little under a third of the population, as opposed to about 68% of viral deaths. These crime disparities, these homicide victimization disparities, have been taboo. You may not talk about them because to do so would lead logically to a discussion of homicide commission rates, because it is thanks to astronomically higher rates of crime commission, that Blacks have higher rates of dying from street crime. So I do not see any cessation at this very moment of poisonous identity politics. And my guess is that the campus culture of narcissistic, highly privileged students thinking of themselves as victims is going to redouble when they come back. In fact, I'm sure you've seen this in the UK, but here you have elite students saying that they're under so much trauma and stress that they should all get A's for the semester. That it's asking too much of them to continue in a admittedly non-ideal learning environment of working online, but nevertheless, the claims are being made again of it's the stress that is so unbearable that they should all be exempt from ordinary academic expectations.
You're listening to The Brendan O'Neill Show. Subscribe now so that you never miss an episode. And it would be great if you could give us a rating and maybe even a review. That is a really good way to help new listeners discover the show.
You mentioned the piece you wrote about the racialization of the virus. And in fact, that was one of the pieces that shifted my mind towards the opinion that this period will intensify the politics of identity and intensify the supposedly woke culture that has had a destructive impact on American and British society in particular over the past few years. The one thing that really stood out in your piece, which I just found deeply disturbing and actually quite depressing, was the fact that senators like Elizabeth Warren and Kamala Harris and Cory Booker have actually asked for doctors' supposedly implicit biases to be investigated. And that gives rise to this very contradictory situation where on the one hand, we are told this is the worst catastrophe to befall our societies for a very long time, and we must all pull together and do our bit by sacrificing our freedom. But on the other hand, the politics of identity grates even against that kind of social role that we are expected to play, because what it does, it just undercuts any sense of social solidarity constantly by looking for a bias and prejudice and the victimization of certain groups over others. So doesn't this raise the question of, you and I will disagree with many other people about how serious the coronavirus impact is, but this does raise the question of if our societies were to face an incredibly serious threat externally, it would be almost impossible for them to organize collectively against that, given the narcissistic, divisive culture of identity politics.
Absolutely. I wonder generally, do we have the character left, the cultural resources, the cultural capital to fight a world war? I don't know. Would we have people willing to go off and lose their lives in a culture of safetyism, number one? And number two, with the identity politics. And one can say, well, this is the Achilles heel, Elizabeth Warren and Kamala Harris and Cory Booker, in saying they want to take vital resources. If this is such a crucial moment, they want to take vital time and money away from looking for a vaccine, figuring out other types of health means that will protect people, to continue what is already a multi-million-dollar industry in the United States, to search out, to smoke out alleged heteronormativity in maths, in computer science, in medical training, implicit microaggressions, you name it. This shows that they're not really serious, that they know that this is not, the end of the world.